Advocates in the long-term care sector and for seniors have often linked inadequate working conditions with inadequate standards of care. Higher workloads mean less time to provide the support that residents need, and that a really high rate of turnover and a reliance on a part-time workforce correlate really closely with inadequate staff training and poor outcomes. And that's really the issue that's kind of at the center of our engagement with Chartwell. It's the connection between the management of the workforce and the quality of care. The Royal Society of Canada described human capital in seniors care last summer as a workforce crisis. In a report it published last June, the Society wrote, "Hands-on care is now almost entirely given by unregulated workers, care aides and personal support workers. They receive the lowest wages in the health sector and are given variable and minimal formal training. They're rarely part of the decision-making process around residents' needs." So the really stark reality of the sort of so-called care in Canada's nursing homes during the pandemic has been really well documented. It's been documented by the Canadian Armed Forces, who were called in on numerous occasions to assist in homes during the first wave of the pandemic, by journalists who've written extensively on this, and probably most poignantly by the families of residents who have described the loneliness and fear and isolation of both residents and their families during the pandemic. Of the 23,000 people who have died of COVID-19 in Canada during the pandemic, just about 70% of them have been linked to long-term care homes. In total, 55,000 long-term care residents contracted the virus over the past year. And that includes 51 homes operated by Chartwell that have been impacted by the virus, and at least 393 residents whose deaths have occurred in Chartwell homes. We believe that Chartwell is facing particularly material reputational risks due to the concerns raised on the standards of care in for-profit long-term care and retirement homes. There is a clear risk to investors, to stakeholders, to residents and workers from the inadequate workforce management in long-term care, and particularly at Chartwell. For that reason, we're asking you to support our proposal. We're also putting forward a recommendation to withhold your vote or vote against the chair of the board, a fellow named Michael D. Harris. As Premier of Ontario, Mike Harris oversaw the deregulation of long-term care and really threw the door open to for-profit care. So the meeting is May 20th, and please mark your calendars.